Chest pain in seniors is a serious medical concern that demands immediate attention. For individuals over the age of 70, the risk of life-threatening conditions such as heart attacks or other cardiovascular emergencies increases significantly. Symptoms may not always present in the classic way, making it even more important to recognize and respond quickly. Delaying medical care can lead to severe complications or even death, as studies show a notable mortality rate in older adults experiencing chest pain. Understanding the urgency and acting promptly can make a critical difference in outcomes. Early recognition and intervention are key to improving survival and minimizing long-term health impacts. Chest pain in older adults is a serious symptom that can signal a range of underlying health issues. Among the most concerning causes are heart attacks and other cardiovascular emergencies, which require immediate medical attention. However, chest pain can also be related to conditions such as angina, heart failure, or arrhythmias. In some cases, non-cardiac causes like acid reflux, lung infections, or musculoskeletal problems may be responsible. It's important to recognize that older adults often experience atypical symptoms, such as fatigue or nausea, rather than classic chest discomfort. Understanding these potential causes helps ensure timely and appropriate care, which can be life-saving. Recognizing chest pain symptoms is essential, especially for older adults. Classic signs often include a sensation of pressure, squeezing, or tightness in the chest. However, chest pain can also present atypically, with sharp, stabbing, or burning discomfort. Some individuals may experience pain that radiates to the arm, back, neck, or jaw. It's important to note that older adults and women may not always show the usual symptoms. Other warning signs can include shortness of breath, nausea, or lightheadedness. Being aware of both typical and atypical presentations can help ensure timely medical attention. In addition to chest pain, there are several other warning signs that may indicate a serious heart issue. Shortness of breath is a common symptom, often accompanied by feelings of nausea or lightheadedness. Pain that radiates to the arm, back, neck, or jaw can also signal a potential heart attack or other cardiovascular emergency. These symptoms may not always appear together, and their presence should not be ignored, especially in older adults. Recognizing these signals early can be crucial for timely medical intervention and improved outcomes. Recognizing chest pain in older adults and women can be challenging, as their symptoms often differ from the classic presentations. Instead of the typical pressure or squeezing sensation, they may experience sharp, burning pain, or even more subtle signs like fatigue, nausea, or back pain. These atypical symptoms are sometimes mistaken for less serious issues, which can delay critical medical care. It's essential not to dismiss any unusual signs, especially in individuals over 70, as they may indicate a serious underlying condition. Understanding these differences can help ensure timely intervention and improve outcomes. Always take any new or unexplained symptoms seriously, regardless of how mild they may seem. Recognizing the symptoms of chest pain early is the most critical step in preventing serious complications, especially for individuals over 70. Chest pain in older adults may not always present in the classic way. It can feel like pressure, squeezing, sharpness, or even burning. Other warning signs include shortness of breath, nausea, lightheadedness, or pain radiating to the arm, back, neck, or jaw. Because symptoms can be atypical, particularly in older adults and women, it's important to pay close attention to any unusual discomfort. Early identification allows for prompt medical intervention, which can dramatically improve outcomes and even save lives. Studies show that delays in recognizing and responding to chest pain can increase the risk of severe complications or death. By acting quickly at the first sign of trouble, you give yourself or your loved one the best chance for recovery. If you or someone you know experiences chest pain, seeking immediate medical attention is critical. Calling emergency services without delay can make a life-saving difference, especially for individuals over 70 who are at higher risk for serious complications. Waiting to get help can lead to severe outcomes, including permanent heart damage or even death. Studies show that older adults presenting with chest pain have a significantly increased risk of mortality within just 2 weeks if treatment is delayed. Prompt medical intervention allows healthcare professionals to quickly assess, diagnose, and begin appropriate treatment. Remember, every minute counts when dealing with potential heart emergencies. Chest pain in seniors, particularly those over the age of 75, carries a significantly higher risk of serious outcomes. Studies show that older adults presenting with chest pain have a 2.7% chance of mortality within just 14 days, underscoring the urgency of immediate medical attention. This elevated risk is due to age-related changes in the heart and blood vessels, as well as the presence of common conditions like hypertension, diabetes, and high cholesterol. Delaying care can lead to severe complications, including heart attacks and cardiac arrest. Recognizing the seriousness of chest pain in this age group is essential for timely intervention and improved survival rates. Chewing aspirin during a suspected heart attack can be a life-saving measure, but it is important to know when it is appropriate. Aspirin helps by thinning the blood and preventing further clot formation, which may reduce damage to the heart muscle. This step is recommended only if the person is not allergic to aspirin and has been advised by a healthcare professional to use it in such situations. If these conditions are met, chew rather than swallow the aspirin, as this allows for faster absorption. However, avoid giving aspirin to anyone with a history of bleeding disorders or recent gastrointestinal bleeding. Always ensure emergency services have been called before administering aspirin. Safety and prompt medical attention are crucial in these moments. If you have a history of heart conditions and your doctor has prescribed nitroglycerin, it's important to know how and when to use it. Nitroglycerin can help relieve chest pain by relaxing blood vessels and improving blood flow to the heart. At the first sign of chest discomfort, follow your healthcare provider's instructions for taking the medication, which may involve placing a tablet under your tongue or using a spray. Never exceed the recommended dosage, and avoid taking nitroglycerin if you haven't been specifically prescribed it. Be aware of possible side effects, such as dizziness or headaches, and always remain seated when taking the medication to prevent falls. If symptoms persist after taking nitroglycerin, seek emergency medical attention immediately. If someone experiencing chest pain suddenly becomes unresponsive and is not breathing normally, it may be necessary to perform CPR. Signs that CPR is needed include the person collapsing, losing consciousness, and showing no signs of normal breathing or movement. In these situations, immediate action is crucial. Begin chest compressions by placing the heel of your hand in the center of the chest and pressing down firmly and quickly, at a rate of 100 to 120 compressions per minute. Allow the chest to fully recoil between compressions. Continue until emergency personnel arrive or the person shows signs of recovery. Proper CPR can significantly increase the chances of survival during a cardiac emergency. If an automated external defibrillator, or AED, is available, use it as soon as possible. Early defibrillation is crucial in cases of cardiac arrest, as it can significantly increase a person's chances of survival. AEDs are designed to be user-friendly, providing clear instructions to guide you through each step. By delivering a controlled electric shock, the device can help restore a normal heart rhythm. The sooner an AED is used, the better the outcome is likely to be. Remember, every minute counts when someone's heart has stopped, so quick action with an AED can make a life-saving difference. In seniors, heart problems don't always present with the classic chest pain. Instead, symptoms such as unexplained fatigue, nausea, or even discomfort in the back can signal a serious cardiac event. These atypical signs are especially common in older adults and can easily be mistaken for less urgent health issues. Recognizing these subtle warning signals is crucial, as early detection and prompt medical attention can make a significant difference in outcomes. If you or someone you know experiences these symptoms, it's important not to dismiss them. Always consider the possibility of a heart issue, even when chest pain is not present. Heart disease remains a leading health concern for older adults, and understanding its risk factors is essential for prevention. Hypertension, or high blood pressure, can strain the heart and blood vessels over time, increasing the likelihood of cardiovascular complications. Diabetes also plays a significant role, as elevated blood sugar levels can damage arteries and contribute to heart disease. High cholesterol is another key factor, as it leads to the buildup of fatty deposits in blood vessels, restricting blood flow. Smoking further exacerbates these risks by harming the heart and circulatory system. By recognizing and managing these common risk factors, older adults can take important steps toward maintaining heart health. Managing risk factors is essential for maintaining heart health and reducing the likelihood of chest pain and related complications, especially as we age. Regular monitoring and control of blood pressure, cholesterol, and blood sugar levels can significantly lower the risk of cardiovascular issues. Adopting a balanced diet rich in fruits, vegetables, whole grains, and lean proteins supports overall heart function. Staying physically active with activities suited to your abilities, such as walking or swimming, helps strengthen the heart and improve circulation. Avoiding tobacco products and limiting alcohol intake further protects cardiovascular health. It's also important to attend routine medical checkups and follow your healthcare provider's recommendations. By taking these proactive steps, you can help safeguard your heart and enhance your quality of life. Consulting healthcare professionals is essential for receiving advice and treatment plans tailored to your individual needs. Medical experts can assess your personal risk factors, such as age, existing health conditions, and lifestyle, to recommend the most effective strategies for managing symptoms like chest pain. They are equipped to interpret atypical presentations, which are common in older adults, and can guide you through preventive measures and emergency responses. Regular checkups help monitor conditions like hypertension, diabetes, and high cholesterol, all of which can contribute to cardiovascular issues. By seeking professional guidance, you ensure that any interventions or medications are safe and appropriate for your specific situation. This personalized approach can significantly improve outcomes and provide peace of mind. For seniors, recognizing chest pain quickly and taking immediate action can make a critical difference. Symptoms may not always be typical, so it's important to pay attention to any unusual discomfort, shortness of breath, or pain radiating to other areas. Promptly seeking medical help is vital, as delays can lead to serious complications. Following the advice of healthcare professionals, including the use of prescribed medications or emergency interventions, ensures the best possible outcome. Staying informed and prepared empowers older adults to respond effectively in these urgent situations. For individuals over 70, recognizing and responding to chest pain quickly can make a critical difference. The 6 essential steps include identifying symptoms, seeking immediate medical attention, chewing aspirin if appropriate, taking prescribed nitroglycerin, performing CPR if necessary, and using an automated external defibrillator when available. Each action is designed to address life-threatening emergencies such as heart attacks, where time is of the essence. Older adults may experience atypical symptoms, so it's important to be vigilant for signs like nausea, fatigue, or pain in areas beyond the chest. Managing underlying risk factors, such as high blood pressure and diabetes, can also help reduce the likelihood of complications. By following these guidelines, seniors and their caregivers can significantly improve the chances of survival and recovery during a cardiac event. Staying informed and proactive about heart health is essential, particularly for seniors and those who care for them. Understanding the warning signs of heart issues and knowing how to respond can make a significant difference in outcomes. Regular checkups, managing existing health conditions, and maintaining a healthy lifestyle all contribute to better heart health. For caregivers, staying educated and prepared ensures you can provide the best support in an emergency. By prioritizing awareness and prevention, you help safeguard not only your own well-being, but also the health of your loved ones.